Hello everyone, how are you doing guys? I hope you're doing fine. I'm Nasser from Respiratory Therapy. I'm gonna go ahead guys and present this project with you about this case. I have a patient, he has subcutaneous emphysema. I'm gonna go ahead and let you know what I'm gonna talk about it in a few seconds through this presentation. I'm gonna go ahead and discuss about the problems of this patient and what's the subcutaneous emphysema, and also we're gonna talk about the reason for this patient, why he's here for the at hospital. I mean, the reason for the admission, prefer the medical history. We're gonna go about the data of this patient. We're gonna see the X-ray. Okay. We're gonna also see the ABG and the lab result. We're gonna see some medications, and we're gonna see the plan for this patient. And the last thing, I'm gonna ask 2 questions, and I'm gonna give you the answer for this presentation. Let's start. Give you just some idea about it. What is subcutaneous emphysema, guys? Subcutaneous emphysema, it's occurs when the air gets into the tissue under the skin. The most often occurs in the skin, covering the chest and or the neck, but can also occur in the other parts of a body. Let's move to the other slide, and which is the admission and brief of the medical history. 62, a man was admitted to the hospital in a motorcycle accident. He has multiple ribs and fractures. After a few days, his face and chest started to swell. A chest tube has been placed in the left side, but the swelling did not improve in the second chest tube placed. We're gonna go ahead and talk about the problems. As I told you guys when I started, gonna discuss some problems. We're gonna go ahead and discuss some problems. Like you can see it here through this slide, guys. Pneumothorax, CHF, lung cancer, anxiety, multigen, HTN, and also the chronic, the chronic contusions and the spleen nutrition. As I told you guys here, if you can see the X-ray, you're gonna read it here, and you can also see, guys, the mandatory side left pneumothorax, 2 large brown chest tube in the place, medicine, the extensive subcutaneous emphysema. Here we're gonna go ahead here, see the vital signs of this patient. Temperature at 7.4, pulse rate 111, respiratory rate 20, blood pressure 128 over 67, PCO2 97. Okay, cool. ABG. If you can see, guys, we do the ABG twice. One of them we do a 3, and the other we do 8. Okay. So sometimes we're gonna follow the order of this patient, and as you can see here, we do it twice for this patient the same day. One of them was 3, and the other one was around 9, 8:55, and which is around 9. BH and BH 7.3 around this time, 7.34 around this time. PCO2 3.5, A3 and A8, as you can see here, from 42.8. PO2 67.9, and here 67.2. H2 15.9 and 24.3, and BE, which is -7, and here -3. As you can see, guys, here. And also I'm gonna achieve some paper, and you can look at it. And I'm gonna also achieve this PowerPoint for you. Lab results: white blood cells 20.6 and 30.6. RBC 2.48, and here, as you can see, 32.8. Human 7.6. 56.2, as you can see, 23.6, you know. MCF 95. Okay, let's move to the other slide. Medications. As you can see here, the medication guides. As you can see it here, I'm gonna list it for you here. The albuterol is here, sodium chloride, sodium dichromate, and also the tromina, and the thermometer, and here sodium chloride also here. Motropil here also. There is some medication is here. Okay, can see it, guys. It's over there in this slide. That's the medication, and I'm listed here for you guys, and you can see it. And for this, for the sodium chloride 3 ml, albuterol 2.5. Yeah, every medication and how to use it, and I mean every medication and the dosage of it. You can see it. Let's move. Plan. Here is the plan for this patient. I mentioned that for you guys since when I start. I told you the plan. Plan after the 2 chest tube in place, we will see if is there any improvement. Okay, we're gonna see if there any improvement from this patient after we see it. Keep the patient in the high flow nasal carrier, which is with 350 milliliter and 65 high flow. May start the patient in BiPAP at night. It's help him to sleep. Misunderstand, just miss this word. It's help the patient sleep. Here we go. We're almost to finish this presentation, guys. We're gonna ask those 2 questions. That's what I said to you guys. What is the subcutaneous emphysema, and what's the respiratory rate for this patient? As I told you, here, subcutaneous emphysema, it's when the air cuts into the tissue under the skin. And this is the most often occurs in the skin, covering the chest or the neck, but can also cover other body, the other part of the body. Respiratory rate was 20. And that's what I have for you guys, and thank you for your attention and for listening to me. And I hope this presentation wasn't that long, and I hope you enjoy it. Thank you.